Hello, everyone, and welcome to the new ANF Academy podcast. Today, I'm interviewing Santi Villamil. He's a physical therapist from the States. Hi, Santi, and welcome. How are you?
Good. I'm here in Florida, the other side of the world, and doing well. How about you? How you doing?
I'm happy to see you again because if I remember correctly, our previous interview was like 2.5, 3 years ago, something like that, I guess.
Yeah.
I guess many things has changed since then.
Yes, absolutely. Not only with life, like we always do with life, but also with the business here in Florida. Not only as a physical therapist and a strength coach, and my business is flourishing, but also with ANF. There's been so many exciting upgrades, I believe, in the ANF education program, but also just in the way that we're approaching the world. And I wasn't really getting that great results. It was kind of more the same. Maybe you learn a new technique. Oh, that's kind of cool, but really it wasn't really helping me exponentially help clients. I'm also very health and fitness vibe. So I'm about wellness and health. So I always want to help my clients, not just get them to the rehab, but basically empower them to change their life through health and wellness and lifestyle changes. And it was difficult during those times in a system that's so focused on like just rehab and then you get discharged, to be able to like empower them besides just like, here's your exercises that you got to do for the rest of your life, right? Once I got introduced to ANF, it truly changed my mindset in how the nervous system runs everything, but also how the body actually heals and how you can actually promote a complete healing of tissue or of a condition or of an orthopedic injury or post surgery, using the devices that I get to use now, because I'm actually making an effect at the like in the biochemical level of things, which is something that you don't learn in physical therapy. It's something that you don't really think about or understand. And then aside from that, working in a system that was like let's say medicine based or like pharmaceutical based, it was all treating symptoms. So once I got introduced to NF and I dove into that fully, I was like, wow, okay, this is truly an amazing tool because I literally have the ability to help the individual restore healthy tissue and neurological oscillation, which is something that I had never thought about. So finding the source is so important, which is what we are taught here in ANF. Whereas before it was just like, okay, let's treat the symptom or let's treat the flexibility. Let's treat the strength.
But if you're treating the symptoms only, what kind of results you got back then? Because you said you were not satisfied with the results. What did it mean?
Yeah, well, what would happen is that, let's say, frozen shoulder. Okay, this is one of the things that just kind of blew my mind. That was like, okay, there's something here. A frozen shoulder in the physical in the PT world is something that I remember. Like, okay, I'm a genius if I catch them in the thawing phase, or it's going to be a long way if I can't catch them in the contracting phase. And I would explain to them, yeah, it's a disease process, and it could be hormones, and it could be just an injury, it could be inflammation. So we're just going to keep working it out until it gets better, right? And I could do manual work and get them a little bit more range, and it's like, all right, we got you 10 more degrees. Or we can work on strengthening, and it's like, all right, you're strong, but they're only strong here until the shoulder started to let go. And then I remember being at an ANF course when you guys came to the US for the first time in Orlando. And we had a frozen shoulder and we're treating the frozen shoulder and we're getting pretty good results. I was like, wow, this is kind of cool. I can get more range of motion. And then Dr. McKell came in and he was like, guys, I know that you're getting some result and it looks good, but I'm going to teach you the holistic way. We're not supposed to be learning this now, but I'm going to show you just how the power of this, because we really want to help people. And the lady that was there, because we actually treat actual people in these courses, she was like, all right, I'm in. And Dr. McKell treated like a recent diagnosis that she had cyst in her breast, that she had just been diagnosed with cyst in her breast, treated the lymphatic system, and then treated the liver. And then she's like, and he said, all right, move your shoulder. And the lady was like, oh my goodness, that's when I was like, all right, I'm in. Like, I've never seen this before, right? So to me, I realized orthopedically, the source of the problem could be somewhere else. And I could sit here forever cranking on the shoulder, strengthening the shoulder, stretching the shoulder. And, you get some results, but it's just a matter of like the disease process happens, right? But with ANF, it was like just seeing like full range of motion, but then less pain and the function come back so soon. I was like, this is just unbelievable, right? And then we weren't even treating the shoulder. So that's when I was like bought in. I was like, let's go, right? That's, like I said, I've been with it for 7 years. So before, people were very skeptical in my profession. Right away, they wanted to fight me. They were like, you're crazy. You're just a charlatan. They were just, I don't really care what people think, which is fine. I would just try to teach them. But I remember feeling a lot more like defensive and trying to explain things to them. And they weren't open to it. But now everybody's open to, like, people are like, what are those things? I want to try it. There's just a lot more openness to it, because at least in my group, people have realized that what they doesn't work. It's just more the same. It's just more of the same. And after 20 years, you can look back and be like, wow, all these courses that I've taken, and none of them really made a difference until I have this device, right? So people are starting to see that. So it's really, really exciting for me, at least. We have to start thinking holistic. We have to start taking the body as taking the pediatrics and the neurological stuff that you learned in school and applying it to the movement that you do to become a better physical therapist, to get better results in the rehabilitation component of things. As far as modalities, there's so many modalities out there, but they're just they're just packaged in a different way. But it's still either ultrasound, it's still laser, it's still shockwave. But so they're still using the same kind of frequency or like modality that creates a stimulus to a tissue to promote like healing or whatever. But it really it doesn't work like how I've seen with ANF, right? You're not restoring that neurological oscillation. You're not optimizing resources that the body uses to heal itself. And it like that quick, right? And it also restores that communication between the neurons and the cells that then repair your body as well. Where some of the other things are just kind of like a stimulus that you get a result, but then you don't really get the oscillation sped up again. Does that make sense?
Yeah.
So to me, that's what's different. And I think now I'm seeing that either some of the therapists they're frustrated because they're not seeing results. Because I also mentor. I have a community where I mentor physical therapists and things like that. A lot of the frustrations are they're burning out because they're just kind of like going to work, doing the same thing. They're getting bored and they're burning out, and they're saying to themselves like, "Wow, I don't even know if I want to be a physical therapist anymore," right? Or they're frustrated with like the system that reimburses you less and less and less for the work that you do. So that now they're like, I'm not making any money. I don't want to do this anymore. Or, so that's the unfortunate part. But to me, it's a systems problem, but it's also an individual problem, because the individual has to look in the mirror and say, okay, why am I a physical therapist? Because I want to help people, right? And then just go back to that, stop being frustrated with the systems and everything like that. And then just look at the person and really start to figure out a way that you can truly help them from a holistic way, rather than a very narrow-minded, like, I am just an ortho PT. I only treat pelvic problems, things like that. In the social media, you do want to kind of niche down and say, hey, look, this is what I focus on. And it's okay to do that. But while you niche down, you should also be able to bring in all the things that I talked about, like pediatrics and nervous system and ANF and all these tools to be able to help that patient. So you're treating the source of the problem, not still doing you're marketing yourself as this, but you're doing the same exercise that everybody is doing. So the client comes to you and, they have the same tool. It's like, I'm a shoulder specialist, and everybody comes in, everybody gets shockwave, right? And they get same results. But with ANF, I can treat the shoulder, but then I can also take your liver, and I can, there's many different things that I can look at based on the knowledge that I gain through the ANF Academy.
If you can put yourself in the shoes of someone who, let's say, finished physical therapy 5-6 years ago, and he or she feels like you described, stuck, feels like, I don't want to be a physical therapist anymore, what would be the steps that you would advise that person to take to get out of that situation?
Number one is like, be okay where you're at. Like, you don't compare yourself to the masters or the person that's been out of school for 2 years, has seen more cases, has more experience. Like, you have the basic knowledge. Just start applying it. but then pay attention, start thinking of like how you can improve and you should get back to being creative. Like, don't lose creativity. I would say that's number 2, like stay creative, right? So like, be okay with where you're at. Don't compare yourself to anybody. Then use your creativity. Like, there's many ways to rehab somebody. Like, have fun with that individual, trying to figure out how to get the outcome that you want because you're thinking about it. And then maybe use the evidence-based practice to be like, oh, okay, that's matching with what I'm doing, or like, oh, I'm on the right track if you want to do it that way, rather than just like, I got to do it this way, because at some point you'll get bored. You'll get bored, or maybe you're just that type of therapist that just needs a job, right? I just graduated, I have a job, and I show up to work, I get my paycheck, and I go home. There's people like that too. That's totally fine. Like, there's nothing wrong with that. But if you find yourself being frustrated or being burnt out or having this imposter syndrome, I would recommend like, don't be afraid of like innovative new things. Like, try them out. Like, go in there just and just do them and try them, feel them, because it's not all just what the school taught you. It's not all the evidence-based practice. It's not all. That is what I call standard of care. And a lot of the people that I mentor, I said, okay, you have a choice. Do you want to stay standard, or do you want to not be standard? Do you want to be elite, right? Do you want to be a master level kind of like clinician that really helps people find the source of the problem and helps them change their life? So that way you can become, at least in my profession, what I would consider like a primary care physical therapist. So I want physical therapists out there to have the confidence that the community will say, oh, my back hurts, I'm going to go see my physical therapist. Not, I'm going to go see my doctor, or I'm going to see my, like, we have to be like the front line of the experts in orthopedic and whatever it is that you love to do. You have to have that confidence and that ability to say, like, come in, I'll take care of you, right? Rather than just being that standard technician that graduated from a school that is being told what to do either by the orders or the company or the insurance company. And again, some people are okay with that, but if you find yourself not, a little frustrated, then I encourage you to kind of just don't be afraid to like think there's communities like ANF community or like my community where we're not gonna give you a hard time for asking questions about like ANF therapy or shockwave or dry needling. We're gonna like encourage you and help you and help you understand those things to help you become a better physical therapist to then help more people, right? If there are people that are telling you that's out of your scope, you shouldn't be doing that, you shouldn't be saying that, like, you just gonna need to just be like, okay, thank you, love you, and goodbye. And then just move on.
I think that's the biggest issue. People are afraid to be judged,
right?
And they don't want to stand out, and they want to be accepted. So when the big mass is saying that's no, even though if they feel it's a yes, they're gonna stick with what the mass says. Yeah, that's a very big issue. Yeah. But as you said, if you want to be successful, if you want to be different, you have to take different steps.
A simple example would be, I had a client that had bilateral knee replacement. So both knee replaced. She did it at the same time. And she started going to the traditional physical therapy place. And after like 2 sessions, she calls me and she's like, Santi, you know what? I know I told you I wanted to use my insurance, but it's just like, can you just see how I'm progressing? So she came in and she really wasn't where she should be. But that's okay. That was the standard of care. But because I have several tools within like 1 week with ANF therapy, right? I use that to remove inflammation, to help the resources there. We got her the range that she was supposed to be at, which was like 100 degrees that the surgeon wanted. And we did that in like 1 session. She had less pain. And then she was walking without her walker. And then she was standing up from the chair independently. And then she walked out of here super excited in like 1 session, right? So to me, that's the difference between like using all the different tools and using your brain to help that individual person. When you do what you love, when you use the tools that you love, and
results speak for themselves, right?
Exactly, the results speak for themselves. And again, I'm biased because I've been using ANF for 7 years, but that also tells the story that out of all the techniques and all the tools and all the things that keep coming out over 25 years, and I'm saying like, this is the one that's been giving me the best results for the past 7 years. Like, there's something.
Why? Can you elaborate why? And can you also compare everything that you learned before you enroll in ANF education? And why is ANF so special? Besides the device itself, that's powerful, and even though it looks very simple, right?
Yeah.
What kind of education did you get when you enrolled? What's taught there that's not taught in universities?
That was the key, let's say, inspirational part of ANF therapy. That sure, there was a tool, and I was like, what is this thing, right? And the technology, you're like, wow, that really works with your neurons, and it's really, really cool. And then you use it, and you get amazing results. But like you said, the knowledge is hands down something that you can't get anywhere else in the world, because Dr. McKell has that's Dr. McKell's brain, right? Like, he has figured out a nervous system and the priority of all these resources. And it's could be very complicated, but he simplifies it in like, okay, guys, there's a hierarchy of how a human works. There's the emotions drive the biochemistry. Then we have the lymphatic system that has to clean things out. Then you have cardiovascular system that has to fuel everything. Then you have the glands and the organs, right? So like, then you start seeing the body as this system that like, it's either going to protect you or heal you, right? And once I started to realize that, I was like, oh my gosh, I could apply this to like how I rehab and how I talk to my patients, how I interview them. Sleep is important, your digestion is important. So, and when I started asking those questions, and the clients and the patients were like, whoa, nobody else asked me that, right? It was pretty amazing, not only to get the buy-in from and the trust from the patient, but also it gave me more confidence, because I was like, yeah, I'm explaining why this works, and not the therapy, not the device, but like how your body works. And they were like, nobody's taught me that before. Like, nobody said that before. I didn't realize my emotions were part of why my neck is tight. So after having an evaluation with a patient, they're like mind blown, and then they're crying because they're like, no, now that explains things. So it's such a completely different approach to, let's say, orthopedic, where it's so focused on like one joint, and then we're also make sure you clear the joint above and below. That's as far as it goes, right? Like it doesn't go further than that. But diving deeper into like the full history of like any traumas that the body has had, orthopedic or birthing or car accidents, whatever, like all of that matters, because our nervous system is always going to be like protecting us. And those patterns is what eventually 10, 20 years later lead to like, oh, where's my neck hurt over here? But the problem was like in the hip, right? So like, to me, that's what was amazing. It's like, it's every patient, every experience, every day, it's like a whole new journey in trying to figure out what's wrong with the person, rather than like, all right, what does the chart say? Oh, okay, it says low back pain, and I'm going to do my 10 extra, do 3 sets of 10, and I got to do my paperwork. Okay, you're done. All right, do the next one. Like, that was so boring to me, right? So the knowledge is by far something that you will not get anywhere else. It's difficult to try to put into words because it is so life-changing that you have to experience it. If you're a therapist that's like a thinker, you might find yourself like, oh, but what? Because that's what happens. People text me all the time, Santi, I'm helping this biceps tendonitis, but the person had all these stress and this trauma, and they had a car accident years ago. Can I look at this? And they're going down the list, and I'm like, that's cool, that's awesome, because now they're thinking, they're having more fun, they're diving deeper, but there's no pressure in like you got to fix the whole thing. Like, okay, good, treat the shoulder, keep doing the protocols, because that'll help, and then we discuss the case on how they can kind of help the person in a more holistic way, right? And then, but if you just want another tool and you're like, all right, I got my tool, I got my devices, I got my protocol. The patient comes in, you treat their shoulder, then you put it on, and then you give the other protocol that the person can put at home by themselves. That's even better, because then they get like double the healing, right? Because you did the work there. And then as a business, for me, it saves me time, because now the person has an amazing tool that they can put on themselves, as I know is helping them better than anything else out there, as far as like inflammation and pain and things like that. And they don't have to necessarily come in 3 times a week, right? So it buys back their time as well, right? And it helps me either see more people or go to my daughter's dance recital or something like that, right? So like, if you're in the business, then you can use the tool also to like buy back some time and things like that.
To be more flexible. At the academy, medical professionals are learning a lot about the neurological system and biochem and how to optimize our biochemical functions, right? But I don't think those terms are widespread. And I think physical therapists don't have any idea why they should learn about biochemical functions and neurological system. So can you simplify why a physical therapist, let's say from California, should have a deeper knowledge on our neurological system and how it can optimize our biochemical functions? What does it mean? Because you've been through the whole education, you're now teaching others. So let's pretend that I'm a physical therapist and I'm used to treat locally, as we just spoke. And I don't have all that knowledge that's taught at the academy, but I've been told that I should dive deeper into these two things. So why should I learn more about it? How that's going to help me get better results?
Yeah, because the nervous system controls everything. Okay, so and I know, let's say from an orthopedic component, we're thinking muscle, tendon, joint, things like that, and we understand. Okay, there's nerves because we studied that anatomy, but we're not putting it together that like those neurons and that nervous system is what's the signaling for the muscle to contract and relax, or to optimize the movement. We know that it's working, but we're not like using it to our advantage. So no matter who I'm treating, whether it's a neuro or an orthopedic or a holistic patient with autoimmune condition or something like that, I always tell them, I'm like, I love you, Tia, you're awesome. I love your story. And I know you're telling me that it hurts here and you want me to help you here, but I'm going to treat your nervous system. Okay. And then they're like, oh, what do you mean by that? I'm like, because the nervous system is going to tell me where most of the problem is, like where the source of the problem is. Because with ANF education, we will teach you how to palpate those main nerves. And if you can find a nerve and you can palpate it and you can follow it to the muscle, then it gives you more information on why that muscle might be inhibited, for example, and not working as it should, right? Whether it's a post-surgical inhibition that happens, or whether it's from an injury that happened 20 years ago and you thought it was totally fine, but that was a problem. So it's all nervous system driven. As far as like biochemistry, we don't dive so deep into like what are the equations of the biochemistry, but it's an understanding that the nervous system is going to communicate, let's say, the movement of the muscles, but at the same time, the nervous system is communicating resources like, hey, I need more blood flow here. Hey, I need more nitric oxide. I need more glutathione to fight free radicals. So like all that understanding from that component of biochemistry helps you better understand how our body functions. And at the same time, help the client in a more holistic way without you even knowing it, because a person has never heard that before. They've never heard like, wait, what do you mean? Like my neurons control my blood? Yeah, absolutely. So this is why I'm putting this little disc here, because when I put it here, I want to optimize blood flow here so your muscle can work and function better. So it gets the blood flow that it needs so you can be a better performance in the soccer game that you're going to have, or things like that, right? Or we have different devices that will also help with like energy, like ATP production, things like that. So that's going to help me get better results in the rehabilitation, because now the muscle is going to have the energy to optimize the rehabilitation process, but also in recover, because now the body's like, sweet, I have energy to be able to heal this total joint replacement, because I'm hearing this strong signal from this device over there, right? So that's how it makes it a little bit different. It's important to understand the nervous system, because it's controlled by everything, especially if you're going to go into ANF therapy, because that's what you're doing. You're literally managing and taking over parts of your nervous system to be able to get the results that you want, but also help aid the body in the healing process or the energy systems and things like that. And like I said, you don't have to dive so deep into it, but it's important to know, because that's part of everything that we do as physical therapists. You know, in order to heal, you got to understand. ANF Therapy and the Academy just kind of puts it together for you in a way that you're like, wow, this is kind of like cool.
How does Academy explains those healing phases? What's
Yeah, it literally is just like you would find in any textbook, because we're not reinventing the way the body heals, right? Sometimes people think like, oh, what is this? I'm like, no, it's show me the evidence, show me the science behind it. I'm like, it's all right there, right? Right? It's the nervous system, it's the phases of healing that you were taught in school. We just dive a little bit deeper into it, and we teach you in a way that's like, okay, these are the phases, and this is how you can target different neurons to clear inflammation and to help the healing process along to full strength of the tissue, right? And at the same time, you can do the rehabilitation. You're doing that as well. It's not here's the disc and see you later. You don't have to be a physical therapist anymore, right? No, it's like you're still a physical therapist and you're still doing what you do in rehabilitation, but you're using the tool to help optimize that healing process, to help optimize that energy so that way the muscles can function better, to optimize that joint so that way the joint has less pain so that you can get more range through it, so that way you get faster results with your rehabilitation. To optimize blood flow, I have a current client that he cut off his fingers, right? And he's been going to the standard of care since November. They reattached them, but he's like very limited. And he was like, oh, they do this every day. And my certified hand specialist is having me do this. And I'm like, okay. And then literally because of the tools that I have in that one session, we got him full grip, right? And then
wow, well done.
blood flow came back, right? The inflammation went down. He can see his knuckles again. He's like, what the heck is this, right? And it was all because of not only the devices. I can optimize blood flow, decrease inflammation, stem cells, things that to help the body kind of heal really fast. It doesn't mean he's healed and he's going to go play racquetball tomorrow. It just means we give it the resources through the devices and through that nervous system, so that way then the biochemistry can be optimized in that area to be able to see the change right away. And then I give them the home, what I call the home empowerment program. I don't call it a home exercise program. I call it a home empowerment program because I want him to be empowered in what he needs to do to regain the function of that hand. And understanding how the nervous system works, that there's a protection pattern. If he cut off his fingers and he's been like this, there's all of these things that are tense, and they're trying to focus on that in the standard of care. And I was like, okay, I want you to do the opposite. I want you to focus on opening up your hand, so that way we can inhibit or reciprocally inhibit the flexors. Open up your hand. That's going to get you to grip better. And he was like, that does make sense. And then he went home. He just said what I said, work on extension, work on opening up your hand. And when he came back the next time, he was like, my hand's so much better. My shoulder doesn't hurt anymore. I can grip better. I went to my physical therapist and she's like really impressed. And I'm able to do my little exercises that I'm doing. I'm like, awesome. Right. So that's the difference in understanding nervous system, understanding biochemistry, and then so that way you can then apply the devices more effectively, right? And then you get better results. And the patient,
so in the first phase, you reduce the pain and you reduce the inflammation. If we talk about this injury right now, but what would be the next phase and the phase after that?
So let's say he's been here 3 times now, right? So the next phase, I optimize blood flow and nitric oxide to help get more blood flow, because the fingers got reattached, but sometimes it's not getting good blood flow, right? Because the bone isn't healing. So now we're attacking that bone healing by using resources. We're still using like the inflammation, right, to clear the pathway so the neurons can oscillate and communicate faster. But then I'm using resources like stem cell, like vitamin D, blood flow, nitric oxide, like skin or like collagen, right? So it's a frequency that we use to help optimize bone healing and things like that. So like, and it's a finger, so I'm just kind of like putting all around, and he'll use his band. He takes them off at home. I just write him a little diagram and he puts them back on. So those are all the things that are going to help, the resources, right, to help the healing process. And the range of motion is coming along. He's still going to his certified hand specialist. He's just coming to me to kind of like check in, and then I get him like I call him like the result, and then and then I'm also teaching him how to get back into fitness, because again, the standard of care can only focus on the hand. They weren't even looking at his wrist and at his shoulder, So I'm mobilizing his wrist. I'm mobilizing his elbow. He wants to get back into an exercise program. So we're like actually going out there and exercising. I'm doing fitness and strength and conditioning and things like that. So he's excited about that because I'm able to apply the discs fairly quickly, get the result there, and then go work the other goals, which is he wants to get back into fitness and feel strong again, right? Because he's just been doing nothing since November, right?
I guess there is that psychological component. When you see the progress, then you don't feel that stress and your cortisol is not that high, so the healing can take place, right?
Exactly. And we have devices that help reduce the cortisol because they're stressed. But when at the academy, we learn part of that education, right? We learn how to educate the patient and how important that psychological component of healing is, that psychological state of mind that we're in after an injury, or when we have chronic pain or chronic conditions that we've been told, we can't help you anymore, or yeah, you'll never run again. So for me, as an ANF therapist, I get to almost give them hope again, right? Like, because everybody's told them you'll never run again. And then I come in and I'm like, well, what do you want to do? You want to do a marathon? Like, why not? I have a 90-year-old guy that came in yesterday that was like, felt like he just needed to just not fall because I just want to fall. Right. And now he's like, after 2 treatments, he's like, oh, you think I can do one of those like savage races where it's like obstacle courses, right? I'm like, if you want to, let's do it, right? I'm like, why not? I'll do it with you, right? So it's like, it just changes the mindset and it puts them in a different mindset because now they're experiencing something different from because now as an ANF therapist, I'm confident enough to understand globally a nervous system, a biochemistry, how the body works, the hierarchy of like emotions, lymphatics, and I can just be like, oh, that's easy. I know how to help that. So then I can help the client get the results that they're looking for, the outcomes that they want. Whereas before I was just like, I only had like this little not like tunnel vision. Like, okay, I have orthopedic and I can stretch and I can strengthen. I can do some manual techniques. Oh, maybe I'll do some. Oh, maybe I could do some dry needling. Oh, maybe I can do. But it was still very like symptoms. It wasn't like holistically minded where you understand the nervous system and biochemistry and healing and all that stuff. So when I first started this, with like I went mobile at first because I didn't have a space and I would rent a little bit of time spaces, but I'll go to people's homes and it was super easy and I didn't have to do an hour of exercise. Like I literally got them the result. They felt better. And I could just educate them on this is what you need to do because it's more important what you do the other 23 hours and you're not with me. So now business wise, I'll have appointments. So sometimes people come in just for like 20 minutes. They just come in for the change because they're independent. I've empowered them to do their thing that they have to do at home, whether it's exercise, whether it's walking, whatever their goal was. And they come in just for the protocol. And I just put it on. How you doing? Quick assessment, 20 minutes. And then they're done, right? Like, so that means I don't charge any less. It's still the same amount of money, let's say business wise, but now I can serve more people and they see value in it because they're like, I'm saving them time. I'm like, I don't have to go and wait for 20 minutes for the doctor to get me in and then do an hour of PT waiting on the bike while the therapist comes to see me. Like, I remember I worked that world, right? So I know what it's like. I was running around between 3-4 people at a time. And sure, I would use the bike because I needed the time to finish the other patient. And I would use the hot pack because I needed the time to get the other person right? So like, it's a complete waste of time. And, and now it's like they get their time back. I get my time to either help more people or go hang out with my daughters or whatever, right? So it's a little bit more freedom as far as like what you get with ANF therapy. But because of the word of mouth, then you get really busy. I love it. But my goal was to maybe see, business wise, I was like, I want to see like maybe 15 to 20 people a week. And that'd be good. I'd be like, okay, I can see 15, 20 people a week. I can make a good income based on what I wanted to charge. I mean, what is today? Wednesday, Thursday? Today's Thursday, right? I've seen like 40 people already. And it's only Thursday. And it's like early morning here, right? Like,
but does it make you feel overwhelmed? Or now when you use ANF therapy, you don't feel overwhelmed even though you treated that many people?
Yeah. No, it charges me up because you're making a difference all the time, right? And the patients also are coming in because they want to be here, not because the doctor told them or the insurance company, whatever. Like I'm cash based. They come in to see Santi, see my Pilates instructor, see my personal trainer, get massage if they need it. But then most of them are coming in because it's like they got told at their church, like, oh man, I know Santi. He helped me with these stickers or whatever. It's like good marketing because people walk around with them. They're like, oh, you know Santi? And they're like, yeah. And then they talk about it. me too. And then all of a sudden, before you know it, like, you're busier, right? So it's fun, but it all depends on your personality as well. But it's definitely one of those
Of
situations.
course, yeah.
Like, I know I'm here to serve. I'm here to, I'm very passionate about health and wellness, and ANF allows me not only to like get results, but also have those conversations with the individuals that are about like, here's what we need to do to kind of like get you healthy again, right? It's not just like decrease the pain. It's like, okay, decrease the pain, but now we gotta like, how are you eating, how are you sleeping, all those things that go into wellness and making a healthy human being.
Okay, Santi. Thank you very much. It was a very pleasant interview. So next time, maybe we won't wait 2.5, 3 years to see what's new.
I know, exactly. And it's so good to see you.
Thank you so much.